I think people will go back in time. I'm speaking to our audience directly. You'll go back in time and listen to this episode because we have some awesome perspectives about how to get into dental school and how to get into endo residency and maybe residency as a whole.
And to answer the big scary question of, you post a video, how to get into, I got into Harvard Dental School. The first comment is always stats, question mark. And to my answer to that is, look at the range on the internet. If you fall within the range, you have a good shot. Even if you don't, you still might have a shot.
That's one of the things I looked for with my applicants. I wanted to see if they made the effort, if they had the energy, if they had the desire to learn about the program before I interviewed them. So when I would interview an applicant, as I mentioned earlier, I would try to find out kind of the honesty quotient. There's ways I can ask questions. And, the worst thing they can do is try to think, what's the answer I'm looking for? I wasn't looking so much specifically for an answer. I was looking for the delivery.
The question of how to get into endo residency, I think I have three things to say. Network. And the reason I say that is because
I can see myself, if I hadn't come to our program and hadn't been under Annie as my program director, the kind of person I was, my wings could have been clipped very quickly by a program director who wanted to have control. Right? Somebody who wanted to kind of make sure that everything is done exactly the way they want to have it done. And they were very much averse to creativity, thinking outside the box, or somebody who wanted to do different things. That's on this front.
So we'll start with this big question. How do people get into dental school?
Yeah, I think one is you need to know your why. Think big picture in terms of like what are your big goals and what impact do you want to have for your whole life. And then let that be your intention for all the things that you do. That's personal to everyone. And so that will make you unique. Like no two people will have the same vision or the same passions. And then for applying that, there are certain things that will, they show skills that will scale to a career in dentistry.
Audio sync. All right. Welcome to the Pulp Podcast, where we talk about all things dentistry and non-dentistry from a generational perspective. I'm joined today, again, with my co-hosts, Dr. Ann Koch from Cape Cod, joining us remotely, and Dr. Parsa Shahidi. All right, Parsa, so we've had a few of these podcast episodes. Today, we have a special one where we're going to be talking about dentistry, student life. So it's going to be one for the young people. So why don't you go ahead and introduce our guests?
Yeah, today's such an interesting conversation because I think people will go back in time. I'm speaking to our audience directly. You'll go back in time and listen to this episode because we have some awesome perspectives about how to get into dental school and how to get into endo residency and maybe residency as a whole. So I think it's a really important conversation to have. So we're really excited because we have two of my colleagues, superstars, Roene Nasr and Heidi Shen at the Harvard School of Dental Medicine. And we're super amped. We see you guys all the time. We're so excited to have you here. So welcome.
Thanks. We're super happy to be here. Yeah.
Second and third year dental students, right?
Yeah.
Really bright, amazing pedigree and background. So
That's
go
right.
ahead. Talk a little bit, introduce yourselves first quickly. Why don't we go first with you, Roene?
Yeah, absolutely. It's such a pleasure to be here. Super excited to kind of jump in, talk about all things that 2 years ago I was dying to know. So I'm sure this podcast is going to be, super applicable for everyone out there who's looking into dentistry, already in dental school, and just thinking about the future in general. I'm a second-year dental student at Harvard this year. I grew up in Syracuse, New York for some of my high school. Some of it was in Canada. And then I made my way over to Philadelphia for undergrad. So I went to UPenn. And then after Penn, I didn't take any gap years and went straight through into dental school. So this is my now second year, and super excited.
Awesome.
Nice.
Yeah.
How about you, Heidi?
Yeah, so thank you both so much for having us here with you today. It's really nice to be able to chat and talk about our journeys. So I was born in Austin, Texas, and then I moved to San Diego when I was 7. Lived there for most of my life, and then I moved to the East Coast for college. Spent 3 years in Pennsylvania at Lehigh University, and then moved up to Boston, where I've been for the past 2.5 years for dental school at HSDM.
That's awesome. I think, it's a cool conversation today because we have the full spectrum. We have previous endo director, Dr. Koch, right? The first endo program director at Harvard Endo, and you taught Dr. Nasseh, and Dr. Nasseh, of course, is my attending in the endodontics department and as a resident, and then we have the dental student perspective. So the goal of the conversation today is kind of talk about what we feel are the keys to success to get into dental school, having been through that and obviously getting into Harvard, and also from the endodontics perspective, and then hearing from you, Dr. Nasseh and Dr. Koch, what makes a unique candidate. And I hope that this can sort of be applicable to everybody across the field who's applying. So maybe I'll start off asking you guys, what do you feel the keys are to getting into dental school as a college student or otherwise?
I love that. I feel like that's the big question that everyone's asking. How do I get in? And I think there's a lot of nuance to it, but this is something I always say when people are asking me, because I get this question a lot, how did you get to where you are? And I'm going to be so honest. I can't say that there's a formula, and I almost believe that if you're trying to follow a formula, you're not doing it right. And so I always tell people that are asking me, what did you do? Can you send me your essays? What activities did you do? And I really, truly believe that if you're not kind of approaching it from a way where you feel passionately about what you're doing, you're entering it and you're doing the activities that bring you joy, bring you life, and make you excited, then I think you're, one, not making the most out of the process, because in our field, there is so much, delayed gratification. And if you're always waiting for the next step, oh, when I get into dental school, I'll be happy. Oh, when I get into residency, I'll be happy. You're missing out on so many of those moments where you could be doing the process, but be happy doing the process. And so I think the key to getting into dental school is to do it because you love it, and then to do all the things on the way that bring you joy and happiness and closer to your goals. And so as you kind of narrow down your goals and where you see yourself in the field, you start to pick and choose where your time can be most valuable, but also not forgetting to spend time with yourself and those that you love.
Makes sense.
Yeah.
Totally.
I guess I'll pause you before you answer, and I'll ask this to the group. Do you think that it's clear that, one thing is, for me, I knew, I decided really late to go into dental school, and same thing with Endo. So if I didn't tell you this, Dr. Nasr, Dr. Gibbs, you don't know that.
That's a red flag.
Yeah, but I didn't know so early, and I think it's a testament to people who do, that they want to go into dentistry. So how do you know that you wanted to go into dental school? How do you find out? How do you go about that process as a young person who has so many different options? And we can all talk about this, and we'll sort of hear from you. What do you guys think? What's the key there? How do you find out?
Yeah, so I started out with the process of elimination. I feel like, I knew that I wanted to be a dentist when I was a sophomore in high school, which is very early on. And it started with me as a child having low tolerance for things that I didn't want to do. So I was like, if I don't want to do it, I will not force myself to do it. There are necessary things you have to do. You have to go through history class, but I'm not going to do extra history if I don't want to do it.
Yeah, sure.
Both my parents are engineers, and I was like, I respect engineers. I just know I can't do it myself. Yeah. I knew that I love being with people and building relationships, being one-on-one with people, having a service-oriented career. That was the thing that I felt most passionate about then, just serving and giving to others. And then sophomore year of high school in the spring, I had a chance. So being from San Diego, Tijuana is right across the border. So I had a chance to go with doctors and dentists from my church and partner organizations in San Diego and LA down to Tijuana. And I saw how with dentistry, it's a skill that you can bring with you wherever you go. It's not just confined to the city that you live in or the office that you practice in. You can bring that with you, and that foundation of trust that you enter into when you meet a stranger crosses all language barriers, cultural barriers. It could be this just two people in completely different stages of life, completely different backgrounds, and still they have a common ground. And, it just is completely different than two strangers. And I was captivated by that. And it left me with a lot of questions going home, because that was the first time that I had seen such a different lifestyle. And the conclusion that I came to after that trip was, I have so many blessings in life, and it's not because I'm more intelligent or that I'm better equipped to use these opportunities or resources than any of the girls that I met there. I was put in this position so that I could like pour out any blessings that I receive onto others.
Wow.
Like it's not
Beautiful.
That's
everything.
noble. That's very noble.
That's nice. I mean, that's the hallmark of all healthcare, industry is the fact that you care. And so
Right.
if you're in
Yeah.
a service kind of, oriented mentality, it's
Right.
kind of a great fit. It's a healing arts, obviously, in many
Right.
ways. So that's terrific.
Right.
It's wonderful to hear that you've done so well. So let's get some perspectives. Annie always has like a big picture view of things. So let's have her come in
Big
first.
picture is a
and kinda
nice
set
way of
some of
saying old.
No, that's wisdom.
When I applied to dental school was very early in the 70s, okay, 1971. And dental school then was very different. And one of the big things was, of course, it was predominantly male applicants and men as dental students. At Penn, there was 152 people in my class. There were only 8 women, and that was a record class size for women. But what was so interesting is that because it was a draft deferment, you had amazing applications. Like, for instance, in my dental class, I think we had 8 or 9 graduates of Yale College and Harvard College. I don't know anybody else from Yale College who ever went to dental school, right? Medical school, okay, and even with Harvard. But what was interesting, it was a draft deferment, so we were getting incredible applications. At our 10th year reunion, probably 40% of my class wasn't even involved in dentistry anymore, but they were incredibly, incredibly smart, creative people. So that changes into where we are now. And as I mentioned a little bit before, I had the distinct honor, and I think it was a privilege, of interviewing applicants for Harvard Dental School for a number of years. And the question that everybody always asks, and anybody who's thinking about applying to dental school must prepare for, is the proverbial, what made you think about becoming a dentist? And I think it is really, really interesting, the background. In those years, and I'm saying those years meaning the early 70s, it was staggering what a large percentage said, well, I had braces as a kid.
Wow.
It was watching how the orthodontic practice worked and how here was the doctor, had a whole team of assistants. Because back in those years, believe it or not, folks, a lot of dentistry in this country was delivered through home offices. And it was nice Dr. Brown and nice Dr. Smith, kind of a one-man show, maybe a person who would sit at the desk and fill in as an assistant. And I just gave a talk last week, and I showed pictures, and Ollie can vouch for this, Ollie and Parsa, of me working in the Air Force without any gloves. We didn't start wearing gloves until 1982, right? So it was a different time, but things change, reflecting how the times themselves have changed. So now you realize that, predominantly, and the ratios can vary up to 7-to-1 female applicants to male applicants. And what I have found, everybody, is that a few years ago, I really made a lot of visits around this country to medical schools as well as dental schools, talking about cultural competency. And the one thing I came away from both schools is that the people who are in dental school and matriculating in medical school these days, whether an allopathic or an osteopathic medical school, they're there because they want to be there. It's not because it's a draft deferment or like, I'm just going to do this until like the draft passes over. The young men and women I've met, Parsa, are in medical school or dental school because they want to be there. Mm-hmm. I think that's a seminal change.
Yeah. I mean, if you think about the logic behind what we're doing, is we're committing ourselves to this really competitive process.
Yeah.
We're studying for all these exams. We're trying to get 4.0 GPAs. Then we're spending a lot of money on the applications and the whole process. And then we send in these applications, and then they select you for interviews, and then you beg them to get in, all to pay $500,000-$600,000 to go through this process. So I totally agree. You better believe that we want to be there by the time we're there. But what I'm curious about is how people find out they want to be there at such a young age. I mean, I didn't know I wanted to be a dentist at all. I sometimes I even think it's kind of random that I'm here, to be honest. So I'm curious, Dr. Nasseh, how did you find out about this process? You have a unique story. I know that.
No, I mean, for me, it was kind of given. I kind of grew up in a dental family. My dad was an oral surgeon growing up. Wanted to grow up to be like my dad. So it just, it was always a given. And that kind of does help to know early on, in fact, because it does help you be more efficient in the process of what you want to do. Because I see so many people get into the process and they're jumping from one topic to the other. They're trying to find out what they like.
Yeah.
And oftentimes, to be honest with you, I tell people, make the decision for what you want to be based on reasons that are rational and wise for your specific situation. And then try to be as good as you can be in whatever you decide to do. And then the love comes with it, like the passion. And people have this Hollywood idea that like you want to go do something, you've got to be passionate about it and go do it. I mean, in fact, I've never met anyone who's passionate about any specific thing that, we do in these type of service industries per se. You may like service, but like the idea of doing any of these things is not necessarily something you'd be passionate about. But once you get into it and then you have the right attitude and you really try to master whatever you do in life, it doesn't matter what it is, I feel like the passion comes after. So it's one of those things where, it's just putting the cart before the horse sometimes is by just doing the passion. But I feel it's much better to kind of do something that is the rational thing for you, given your situation, or the things that you want, or the kind of lifestyle that you want, or X, Y, and Z, and then just dedicate yourself to it and be as good as you can be. And then before you know it, as you get better at it, you develop a passion. I mean, Annie and Heidi, you guys play tennis. And actually, Roene, you play tennis too, right?
I do, yeah.
So this is the same, any of these sports, and you play tennis too, actually. We should play.
Yeah, here and there. Dr. Koch would beat us up, though.
Betting on the ladies.
Annie's
Carlos
amazing.
Alcaraz over there, right?
Next podcast on the tennis.
Yes.
No, right. But I mean, it's like when you start these sports, you're not necessarily passionate about a sport before you go and do it, and then you just kind of realize, I like this, and then you get good at it, and as you get better and better at any of the sports, suddenly you begin to like it more and more.
I agree.
Right?
Yeah.
So I think that if the effort is put into getting good at whatever you do, that passion part will come. So for me, that was my story. Annie explained that she had a unique story too in that sense.
Yeah, but I'm gonna pass that because I have a question I've got to ask, because I think this is so important. It has to do also with the school. For both of you ladies, did you have a sense of any outreach by any local dental association or dental schools in terms of kind of recruiting you to the idea of dentistry as a fabulous profession?
I can't say that I did.
That's amazing at Penn, because, as you know, Penn for like 150 years has been multiple track program crazy, which is wonderful, right?
I know.
Like DMD, MBA, MD, MPA, that kind of thing, right?
I agree.
And it's been wonderful. But I can't believe the dental school didn't have a reach out to you guys promoting dentistry as a career.
So it's interesting. I think that, so they make an effort absolutely to, like, everything in the space is very accessible, but it's almost that you have to be the one seeking it out. And so I actually found dentistry through shadowing in my hometown in Syracuse first. Once that excited me a little bit and I saw myself doing it, I brought it back to Penn, started, I found a PI at the dental school. I started shadowing and assisting there and just learning about it through there. But I wouldn't say that I was necessarily exposed to it before I decided I wanted to be exposed to it. Joining Pre-Dental Club, they do those presentations, but you have to be almost someone who's like looking for them.
Right.
Yeah.
Mm-hmm. So, becoming a dentist, like we talk about, like what is our background and so on. But what does make, Annie, in your opinion, and also in everybody's opinion here, actually, Parsa, what makes a good dentist? Or for that matter, maybe later on we talk about what makes a good endodontist, because, I think in some ways we need to kind of first define what makes a good dentist, what are the qualities that make one, so that for people who are interested in becoming a dentist, see if that even matches the personality. I mean, that may not be the right thing for them, right? I mean, then we can talk about how to get into dental school, but let's just kind of set the stage for what makes a good dentist in this field. What do you think are some of the qualities, Annie, that you want to see?
Years ago, when you applied to dental school, you had to do a chalk carving. Is that crazy? You had a piece of chalk and you had to do a couple of carvings on it, and you got graded. That was part of the thing. In addition to the tests, I'm assuming no one's doing chalk carving anymore, right?
No.
Yeah. Okay. That test to me was like completely useless. What is that going to prove? Only thing that proves that somebody took a crash course, like a Kaplan course, and practiced chalk carving, right? But for most people, you never carve chalk with a buffalo knife. Also, when I went to school, this is many years ago, in dental school, it was predominantly engineers. A lot of engineers had applied to dental school. And I could understand some of that, but I think, Heidi, as you know, engineers are pretty firm in their way of thinking.
Yes.
I'm not going to open up a can of worms with that. But
Especially with Parsa,
think
his background is
through the
engineering.
years,
Watch
what
out
I
what you
have,
say.
Yeah, come on, Dr. Koch. Don't talk too much smack over there.
no, it's absolutely true. I mean, you're an exception, but most engineers, and I understand why, think that they know everything.
They're very
Well,
Now that you say that, actually.
Yeah,
But anyway, I am still impressed anytime I go over a bridge with engineers. So
So Heidi, from what you say from the chalk carving, I would assume that what you're talking about is having a sense of manual dexterity, right? Because there's one thing is just, how book smart people are.
chalk carving didn't prove that.
Didn't prove that. But that isn't, but don't you think that's an important part of it? Because, it is.
No, I think anybody, I'll give you an idea.
You think everybody can learn to be good manually?
We only had, and this was really wonderful at Penn, Roene, because we had a couple of students that by junior year, you realize they couldn't even make a preparation in an ivorine tooth.
Oh,
It would be
gosh.
just a black, smudgy, melted mass, right?
Oh, no.
So what the school ended up doing, there was some other schools in the area that were actually failing out junior students.
Wow.
Like how does it take you 3 years to make a decision that this young man or woman is not going to make it all the way through?
Yeah, wow.
So we had 3 people in my class, and what they ended up doing, 2 went over to the med school, and one went over to the vet school. All right, but everyone else, the other
Not a bad backup plan.
49 people learned how to make things, and so I think the dexterity thing is a little overplayed. What I'm looking for a person who can think on their feet, and as I mentioned last week about Grace, I really want somebody who can empathize with the patient.
Totally.
When you're dealing with people, and especially anyone thinking about endodontics, my God, when you come in and you have a patient sitting perpendicular in a chair and you say, "Hi, good morning, I'm Dr. Koch," and they start crying, that's going to be a challenging appointment. So I really look for people, and I think, and I'm not going to get into the women have more empathy than men. You guys can make your own decision. But I'm really looking for someone who can think, make decisions on their feet quickly, make the right decisions, and who has the ability to empathize.
Yeah.
Absolutely.
I have to say, I think the way that I look at getting into dentistry is a little different. I think, first of all, you need to have the interest to help people. So that's step 1, right? Step 2, I think, so then we're thinking about all these healthcare. You could be a physician, a dentist, a vet. You could be a physical therapist. We have all these things at our disposal. And then, so why dentistry? I think dentistry is cool, and I'm preaching to the choir, because it allows people who are interested to do maybe more than just serve people in the healthcare capacity, that luxury. They can afford a great lifestyle with a lot of their own time at their own disposal.
Yeah.
Like you said, Dr. Koch, it's like dermatology or ophthalmology or some of those things where you get a lot of your own time to be managed at your own disposal. That's second of all. Third of all, I think if you are entrepreneurial or if you're innovative, I think dentistry is a great pathway for you because it allows you that time and also bandwidth to do so. Medicine is so impressive, but also can be grueling. So sometimes if we're thinking about, let's say, some of our friends or colleagues who are in cardiology or neurosurgery, those hours are demanding. So dentistry is a great balance for that, for the folks who are doctors by nature, want to help people, but want to express this other part of them. And that's what got me interested. But I think the key, your question, Dr. Nasseh, was what makes a good dentist? And I think the answer is you have to have some level of resiliency and some level of composure, right? When you come over and you tell it, we're trying to find this MB2 and we're 13 millimeters trough, and you come over and do it in 2 minutes, it blows our mind. But the reality is it's a resilience, composure. We may get flustered, but you tell us, you have to stay calm. You have to just focus on what you're doing. So many things go wrong, I feel like, on a day-to-day, and you have to be able to maintain that to be good as a dentist. That's just my 2 cents. I don't know what everyone else thinks.
I mean, everybody here has a learning background. We all know that learning is iterative, right? I mean, ultimately, it's all about resilience because you have to get used to making mistakes and then not take them too personally so that you can then grow and get better. It's the only way you do get better. So that's completely given. All of us start from a state of like not knowing anything, and we make plenty of mistakes, and then you go through the mistakes. And what I tell the residents, Annie, listen to this, is that I say that, look, all that happens as you get better is the amplitude of your good days and bad days becomes shorter, but you still make mistakes. It's because you're human. It's just that it's much less catastrophic, and it's, you can manage them, and you can manage, contingencies and complications. So those are the things. But I want to get back to the manual dexterity, Annie, because I mean, that to me, that's an important part. And that's like, it's not tested in dental school, right? And that's an important part. Unless you want to be, I mean, we have the option of going into what? You can oral pathology, you could go into oral radiology, you could go into anesthesiology. You can even go to ortho.
Sorry, you can also work for the insurance company. Right? Yeah.
That's right.
Consulting.
No.
Do you guys think dexterity is important? I mean, what do you think?
I think that it will. So I think in dental school, if you come in with good manual dexterity, it'll give you a leg up.
Yeah.
But that's like looking at the beginning, right? I think if you look at someone who comes in with really good manual dexterity versus someone who struggles a bit more, like there's a big difference year one. But then when you look at year 50,
Right.
I don't believe there's going to be a huge difference. I feel like
Absolutely.
attitude matters more. Like there's someone who has poor manual dexterity who's like, that's fine. Like, I will like put in 3 extra hours on Monday, Wednesday, Friday, and then, this is how I'm going to get better. I'm going to work with my faculty and like tutors. That's one person versus someone who's like, ugh, I suck. Like, I don't want to go practice. And then that's really going to be the
So that's actually a very good point. So you may not have the manual dexterity to begin with, but if you have resilience, you will learn it, as opposed to give up too quickly because you realize, look, I just don't have the hand skills, so I'm going to make a bunch of mistakes, and now I'm going to give up. So I think that's actually very good. It dovetails well with resilience.
Yeah.
So it's you learn that as a motor skill.
But carving a piece of chalk doesn't really show that. That's what my whole point was on.
Yeah.
I guess so. You're right.
Yeah.
Get back with what Heidi was talking about. I remember when we first started doing, putting wax on things and carving teeth, and we were all thumbs. There were 3 people in my class. Their teeth looked like they were like cast. It was like perfect, right? But all 3 had worked the summer in a dental lab. So they had a huge jump on everybody else because they had actually worked in a dental lab. But by year 2, everybody, it wasn't like 50 years. It was much quicker. Everybody got to that same kind of level, except for like the 2 or 3 people.
Carving a piece of chalk, Annie, could also, land you a nice gig on a side job to work at a cruise ship and do some nice carving at a dinner table or something.
I was like an economics major, right? And they used to have preparatory courses where people would learn how to carve a piece of chalk with a buffalo knife. I think that's borderline absurd. Well, forget borderline. It's absurd. Okay?
I have
Now,
to
let me
say,
ask you a question, because I think this is a huge deal, and it was for me on asking the question side of the equation. I think the interviews are incredibly important.
oh yeah.
And jumping the gun a little bit, Parsa, certainly when I was looking at endodontic interviews, I would get all my applications and I would cut it down to 20 people. And it would start all over, just like playoffs in baseball, the playoffs in hockey or basketball, right? Mm-hmm. If you were the first person I was thinking of asking or the last person, number 20, everybody started equally again. And then you had to sell to me why I should take you. Going back prior in the process to the dental school, did both of you interview at schools, at Harvard, among other schools?
Yes. Yeah, definitely.
Could you share a little bit of that process? Because I think when I used to do a lot of interviews, even on the postdoc side, I would interview people kind of as the warm-up interviewee, another interviewer, because they would realize, well, Annie's pretty chill, Dr. Koch is pretty chill, and people would be like so nervous, right? And I would like have them relax, take it easy. This is fine. But the one thing I really forgot, and then all of a sudden it became very aware to me, most faculty people are not fully aware how much stress students or prospective applicants put upon themselves. So when you go in for the all-important interview, guess what? It is all important, but how you handle that is so difficult and so challenging. So I would like to hear from both you ladies how you prepared and how your interview process went.
Absolutely.
Yeah.
I think this is something I thought a lot about. Well, one, because I love to chat. And so an interview is actually one of my favorite parts of the application process. And it kind of brings me back to what I was talking about earlier. Just because I think that I involved myself in things I really cared about, I am just so giddy at the fact of like when I get the opportunity to talk about it. And I always tell people the reason why I give you this advice is because when you go to sit down in your interview, if you're saying, yeah, so I published an abstract and blah, blah, versus I did research in this lab and this is the work. And you can just tell when someone's excited about what they're doing and that's what they want to do. And you're like, yes, because I think what we were all kind of getting at, and I think what I narrowed it down in my head was how multidisciplinary and multifaceted dentistry is. And what makes a good dentist is I kind of like boil it down to three things. One is who you are with yourself, how resilient you are, how much you're willing to work on yourself, improve yourself internally. The second is how you are with patients. How do you build rapport? How do patients feel when they talk to you? It's so important the way you're making that patient feel in the chair, regardless of your knowledge, regardless of the textbooks. And then the third is how are you with your team? Because dentistry is such a team sport. And I know that dentists have so much ability to kind of like take themselves in the path and direction that they want, but they're still working with so many people along the way. And how you interact with others, both at your level and honestly, everyone's at our level. It's just we're all doing different things. And so it's how you're interacting with those people and how you're carrying yourself both in and outside of the clinic. And so I think that's what the interview is meant to do, is to see all of those sides of you come together, speak about who you are as a person, what matters to you and what you've done and why you want to go into this field or specialty or whatever. And that's kind of the chance where you get to showcase the genuine aspect of that and that you are more than who you are on paper. Because being on paper, I think it's different.
Yeah.
So about you, Heidi?
I think that over time, how I've started to see interviews is just like a personality check. Like you've made it this far. There's so many things you had to do to get to this point, and you walk through all those doors. Now it's like you're smart, you're hard work, like you check all these boxes. Now, are you a good person? Like like we see each other a lot around school.
Yeah.
Is this someone that we want to add to the community? Because each person shapes the culture of the school.
Totally.
So is this someone who has a culture that we want to add to the school? Is this someone that people would enjoy talking to? And I think that like just thinking about that, because I think that is like when I interview people, I'm like, do I like you? Are you like a good, normal person? Are you fun to be around?
Yeah.
And that took a lot of pressure off of my interviews as well. So I felt like the majority of my interviews were very conversational, very casual. But there was one school that I think played the good cop, bad cop style.
Oh.
And so I think that they sent the first person in to relax you. It was so chill. I think he asked me one question and then we just talked about sports for the rest of the time. It was so chill.
Sounds nice.
Yeah, it was so nice. And then the next interviewer, we went through 20 questions in like 35 minutes.
Whoa.
And they were hard questions. But I was like, at the end of the day, like she's a mom. Like she's a person and like, yeah, she's a dentist. She's an interviewer at this school, like prestigious school. But at the end of the day, she's a person and like we have so many things to relate on. And then I was like, I'm just chatting. Like these are good, introspective, deep questions that like you can think about it like, oh, she's trying to grill me. But I think it's like she's just trying to see who you are deep down.
Right.
Yeah. So then it ended up being one of maybe my best interview like ever.
That's awesome.
Yeah.
What wasn't Harvard though? It's funny you say that.
No,
It's all right. You don't have to give a name. I'm just kidding with
Our
you.
interviews are cool.
What do you
One of the
think?
things, Parsa, that I used to do, Ali may not remember this, but I was asked by Dr. Lin, who was just wonderful with undergraduate students at the school. I used to do a 1-hour presentation and it was titled How to Get into the Postdoctoral Program of Your Choice.
Oh, wow.
So the first year I did it, it was very positively. I even had how many paragraphs on a thank you note. The second year, we even had people come up from New Haven, came up from Yale.
Wow.
And I did 1 extra year. And I thought it was really, really important. And one of the things I thought, especially on a postdoctoral application, but even on an undergraduate, try to know something about the school before you go in for the interview.
Oh, totally.
Try to get somebody who's actually a student there. Try to get the ability to speak with them, especially on the Endo thing. And I hate to be out of touch on this, but I'm assuming Endo is still not in the match, right?
No,
No.
it's not.
No.
It's not. Okay, it's the only one that's not in the match. So it really helps if you're applying to a postdoctoral program, speak to the residents and they say, well, we do a fair amount of surgery, but we don't do any retreatments. They all become implants. that's kind of a thing that for you being interviewed, you can broach that subject. And most people who are interviewing are going to be very impressed. And what they're impressed about is not even necessarily what your statement was or what it means, but it's that you prepared enough to make the effort to investigate the school. It's like I had some people come and they would have a whole portfolio of gorgeous root canal cases. And they said, this is what I did. That means nothing to me. I don't know whether your brother, the endodontist in Missouri, did it. I have no idea. But what it would impress me was that the student made such an effort to put together such a portfolio. And so I think there's a method to the madness of getting prepared for an interview, trying to know as much as you can about that school, if it's a postdoc program, about the specifics of the program. And I think, again, what the key thing is, the person interview you 90% of the time will be impressed just that you've made the effort. And the one thing that always amazed me is Ali and Parsa were there 2 weeks ago when I was talking about the lack of grace in our culture. And I talked about team culture. The hockey team is the best culture I can think about how you build a culture. But I like team efforts, Roene. I like, there's no I in team, that's an old saying. So I really think that if the interviewer is interviewing you and you made this effort to know all this stuff about the school, I think that's seen in a very, very positive manner.
Totally. I think just as important is asking questions at the end, and not the questions where you're like, the person is, you could find this on the website type of questions.
Yeah, right.
It's asking questions to show that not only do you now know about the school, but what else are you eager to know? What else have you not found out that you're still interested about, that one can kind of tell about you and your interest, but also two, what you're looking for, and just demonstrating that, this is the school you want to go to, and treating every interview like this is the school I want to go to. And everyone deserves that respect regardless, right? Because it's the same with your patients. Every patient deserves, you're the patient I'm seeing and I'm going to be present today.
Right.
How many schools did you guys apply to?
Process.
Dental schools? Did you each apply to like 7 or 8, or did you have like a crazy number?
I think I was nervous because I just wasn't doing a gap year, and I found dentistry kind of late. I found it the summer after my sophomore year, and I applied the summer after my junior year. So 1 year of dedicated dental prep. The rest of it was pre-health, just kind of knew in general what I wanted. So I applied very broadly. I think I applied to 20 dental schools. Yeah.
It's a good idea. I mean, it's highly competitive nowadays, to be honest with you. Yeah. So I think the more chances you have, you want to be the one selecting and choosing. Why not?
Yeah.
Right?
Yeah.
I mean, what's the reason not to? It's not like it's a exorbitant kind of price for applications or any of these other issues. Might as well apply to as many places. But I want to actually quickly talk about, because the interview thing to me is really crucial. It's very important because all of us. So actually, as a little bit of I got to do a waiver because I am on the admission committee at the end of the program at our school. Nice. So I'm not speaking on behalf of the school. I'm just sharing my own ideas. You have to have these waivers and so on, so that whatever I say or share is just my own opinion and doesn't represent our school of medicine. So with that said, I mean, in essence, you're looking at in an interview, when you get somebody in an application, our acceptance rate in our program is somewhere between 1% to 5%. So there's a broad range of people that apply, and it's all by comparison, right? Mm-hmm. So the question really becomes, and everybody has they have good grades, and everybody's done a bunch of different things, and obviously they've chosen to have good recommendation letters, so everybody's good. Those are the tangibles that you kind of read and see, but the intangibles are, as you said, is like who is going to fit the culture of the program better, who is going to add value, who's going to be an asset to the program. Yeah. And these are the kinds of things that you get from an interview, because even though, to be honest with you, it's fairly short and you really can't get, everybody could be on their best behavior. And that's why I usually recommend people to really be genuine and to be authentic and to really be themselves. So when they say, what should I do in my interview? I say, be yourself. But here's some of the big tips is to, as you said, to lean forward, to be energetic, to not just kind of shy into yourself and just kind of forget about, how wonderful you are. Just kind of put it out there and show the kind of energy that you have and what you're going to bring to the program. It is, as Annie said, it's a teamwork thing. We're looking for people that are going to be into a system together. So those are really important things. I think Annie wants to say something.
There's something that's so important here. Most people, when you go for an interview, think that the person interviewing you is staying up nights looking at your CV.
Oh, yeah.
Nothing could be further from the truth. What happens, like somebody will be in a school and there's a person who's like from some school and they're due for interviews. It's like, listen, John, do you have any free time? Can you do an interview for me? So the interviewer, he's given you a folder. He knows nothing about you. Okay. And I think that's the one thing that a lot of people going for interviews just don't understand. They think, oh my God, the person interviewing me is going over every little thing 2 nights before. No chance. Why am I saying this? You have to say yourself in a way that is, it's professional, but also don't be afraid to share your enthusiasm. So if you're an NCAA finalist in tennis or karate or whatever, bring that also into the conversation. Don't cut yourself short in your accomplishments. You're there. So whether that interview is 15 minutes or it stretches to a half an hour, you've got to sell yourself. And I think most of the people certainly applying to the HSDM and Penn, they have a lot of things that they've accomplished. Don't be hesitant about sharing. Don't ever assume that the person interviewing you has read it and knows that about you in your past.
Mm-hmm.
Yeah, that's a good thing. Having a little elevator pitch at the beginning and then moving on to the questions and so on. So we see a lot of people. Actually, to be honest with you, like we should ask him because his interview, I remember, he kind of blew everybody away on the admission committee. He was like amazing.
Didn't know that.
It was like, oh my God, this guy, So why don't you share? How did you prepare for your interview?
Yeah, I think on the subject of the interview, because I think there's a few aspects that we will cover that we haven't, but the interview is important because, like you said, you get in the door and you know that you've met some level of requirements. We're talking about a high level GPA. You probably are a smart, ambitious person. You've maybe done research. You are a good fit so far. Now it's about how do you mesh with the faculty. I think the first thing you have to think about is everything you do on interview day matters and everyone sees everything. Totally. So that's important, right? I remember on my interview day for Endo, we had somebody, no one here knows that person, but we had somebody whose attitude was so bad. Oh, no. And everybody picked up on it. The interviewers picked up on it. The interviewees picked up on it. I'm pretty sure the staff picked up on it. I mean, it was hard to not sense the problematic attitude. So the advice is, be nice, be fun, be outgoing, be energetic on the day of the interview. There are people who are shy or introverted, totally understand it. Everybody's different, but do your best to bring yourself to connect with the people you're talking with, because like you said, Dr. Nasseh, you guys and the people in the selection committee they're thinking about how to fit these pieces of the puzzle together so that there's a team aspect, right? So this person may be a future pulp biology researcher. This person may be a future biomaterials researcher. This person may be an AI researcher. This person may be an entrepreneur. How do we create the team with the best valuation that we can have moving forward? So put yourself in a position to succeed. I think on interview day, playing the part matters, right? Dressing well, acting professionally, making an effort to read about the people who are interviewing you. I think it's undervalued. Knowing the background of all the people we're interviewing. I remember doing the same thing. And also making sure that the places you're going to interview, you have a genuine interest in going. I mean, there are some people who take interviews and have no interest in going there. At that point, you're taking away a spot from somebody else. So playing the part matters. And last but not least is knowing where you're going to give value is important. So you're not going to be just another resident in the equation that's going to come out and be a cog in the machine, but this is how you're going to actually impact the ecosystem of Harvard, for example, for 10, 20, 30, 40 years, and why somebody like Dr. Koch, like Dr. Nasseh is willing to take a bet on you so that you can do that. I think interview day is huge, to be honest.
Oh, yeah.
Absolutely. It's the most important part of the whole process, in my opinion.
Something else that I want to say is I think that you don't know who is in the room with you. Like when you're at the front desk checking in, you don't know if someone, they're a complete stranger to you, but you have no idea who they are or if they're observing you. So it matters how you treat people who you think offer no value to you. Like, for example, front desk, security guard, custodial staff, be kind to everyone. Yeah. But that shouldn't even just be on interview day. That should be your everyday. Yeah. So that should be put into practice in daily life. But I think be cognizant of that when you're just how you present yourself in every room.
Yeah. And a small point to your point, Dr. Koch, earlier, because I think it's really important that the person sitting in front of you really doesn't always know and usually doesn't know anything about you. And I always tell people that I think there's a strong skill in taking the interview and navigating it where you want it to go. So someone could ask you a question, you could respond, okay, I've touched on my community service. Amazing. Next question comes in, and you kind of want to start to field those questions in the way where you're able to get that fully comprehensive picture of yourself. You're not just hammering the same thing over and over and not getting them to see all sides of yourself. So also playing it in the way where, not forcing it necessarily, but being cognizant of what you want them to know about you, and not just in the tell me about yourself question, but in the overall grand scheme of the interview. What do I want them to know about me? Who am I, and how can I get that across today in the limited time that you have? Like you were saying, it's not that long.
Like guiding the conversation.
Exactly. Yeah.
What do you guys look for from your perspective when you're interviewing people? What do you think are the hallmarks of a successful interview?
Riley, go ahead, you first.
For me, I can tell you my whole thing, and everybody has different things, but I think I'm a pretty observant individual, and I do also like to talk. So I'm very comfortable with speaking and the communication. But my big thing is looking for honesty. And I had an applicant one time, I was applying, so I said, how many root canals have you done in your dental career? Person could have said 6, 7. Person said 2, and they both were only central incisors. I really couldn't care less how many root canals that person had done, because I'm going to show you how to do root canals in the program. Nice. But what I wanted more than anything else, I wanted somebody who was honest. Okay? Because if you're not honest, it doesn't work. All right? And so for me, finding out, and this is kind of what I think Heidi, you were talking about, finding that inner glow on a person. Like, are you going to be shading things? Is everything going to be shaded, or is you going to be out front and honest? And this young person, I mean, I understand the stress I put them under asking how many root canals have you done? And what do I say? Do I say I've done 7 teeth and 2 molars? No, he's just said I only did 2, both central incisors. Could not have given me a better answer, because honestly, I don't care how many you did. I'm going to show you how to do this. I care most importantly about honesty. That's me.
I mean, it goes back to what we were talking about, the intangibles, right? I mean, honestly is clearly one of those things, but more it goes back to the idea of this person is going to set the culture of the program, is going to be a part of the program. In our case, for 3 years, some of the residents do 4 years with the DMSC. In many of the other programs around the country, it's 2 years. It's still a lot of time that you're going to be spending with the program director, with the faculty, part-time and full-time, and the other students. And if you don't have the right mix and you don't have the right, it just takes away from the morale. And if you have good leadership in the program, you try to always set forth a positive, we're all here to learn together kind of an attitude. Yeah. And that cannot be, it goes back. I mean, Annie's point about, it's almost a cliche thing of there's no I in team, but it is really an important point of everyone working together to achieve something. So for me, having that growth mindset, having the curiosity, the kind of, obviously compassion and all that stuff is important. That goes without saying. Mm. But, critical thinking, curiosity, creativity, and then the courage of going out there and making mistakes and recovering from these mistakes. These are all critical things that I try to look at. Of course, again, like I said, in a short time period, you can't really tell because you're just seeing someone for a little quick thing, but, something stand out. Mm-hmm. So having that effusive kind of positive energy of wanting to belong and being open to learning and being open to be criticized in a positive way and recover from that. Mm-hmm. And that's great. And I think, I'm sure all programs out there are really terrific. We're really lucky to have amazing residents such as Parsa and the rest of our residents. We're really happy. Everyone's really great. And I'm sure it's the same way. I mean, by the time people get to a postdoc program, they've already been through, 8 years of education, and they've done really well in their program. So they've, it's a long process. So people are now matured up to be a professional, really, and hopefully by the time they get out from the other side, they are. But that's actually a good point, Annie. So what do you think? I mean, the positive things you mentioned, I'm here to teach you how to do root canals. And I think that's one of the strengths of our programs, because we're 3 years. I say, people apply from dental school straight instead of doing an AGD, because experience is important, what we want. But having a 3-year program, that's an advantage. What else do you look for in a resident that you think is good? I mean, a 3-year program I think is great because people, everybody who leaves is really.
I mean, I'm going to be very honest, and people can, hate me for this, but when I was running a program, I was looking for an engine. Okay, it's Harvard, and I was looking for the engine. Now, if you have people who maybe don't have the same engine, but they have some other experience, that's kind of an easier group to handle, right? There's a more maturity, and I understand there's many endodontic postdoctoral programs that will not take somebody directly from undergraduate dental school. They like to have somebody in the service or had a GPR, stuff like that. To me, I was looking for the biggest engines I could find. And that made my life very challenging, like 80 hours a week at the school, because I had guys like we created a night session.
You got an engine. Yeah. Do you mean energy-wise, Dr. Koch? Are you talking about energy? What are you talking about when you say engine? When you are looking for an engine, what does that mean?
I'm talking about smarts.
Yeah.
How's that? Okay.
There you go. That's she's looking for smarts.
Here's the reason I say that is that what happens is Ali could talk about some of his classmates. These are people who are very smart. They were type A personalities, very driven, like hello. And that makes it more challenging for a director, okay? It's really interesting, like Dr. Nasseh, every week he was doing a different technique. And they would say to him occasionally, this Ali, could you occasionally tell me what you're doing? I'm like running the program, just to help me out here, bud. But what I was looking for, that was my challenge. And so if I wasn't able to stimulate them enough, that's on me. But I wanted to make sure that for me, I had people, the more I could give them, the more I could ask them to do. And that whole expression about to those to whom a lot is given, a lot is expected, something like that, paraphrasing, I 1000% believe that, okay? And so I also thought, and this is, I'm going to be particular with the institution, this was a place where people could be really stimulated. And the person sitting in front of you, Parsa, he actually took courses over at the college. And that kind of thing, it's a wonderful university. And all dental schools are within really good universities. I want people who have the energy, have the wherewithal, have the confidence, have the smarts to not just go to here and meet all the requirements. I'm not looking to create someone who's going to one-step a premolar in 40 minutes or 20 minutes. I'm looking, and I was looking, to have graduates, to produce graduates that would change the specialty, okay? There's a big difference. Oh, wow, it's great, Dr. Koch, I can one-step a premolar in 20 minutes. I'm not impressed, okay? But if I'm able to succeed enough that I can create graduates that can change dentistry, it can change the specialties, and I don't care which way, whether it's clinical techniques, whether it's management techniques, whether it's investment techniques, it doesn't matter to me. But I want people who are going to be exceptional. That's what I looked for.
So I think what Annie's saying is amazing. And I think I want to also say this because I want to add to this in that over the past few years, I've had the privilege of also being able to go to a lot of residency programs around the country. And I must say, really, Annie, and you've said the same thing too, that the residents and the students out there in all of these programs are amazing. I mean, I think we're all really blessed to have amazing set of endodontists, endo residents that are going to graduate and be excellent clinicians and excellent and compassionate dentists. And I think that, and endodontists, and I think that's really amazing thing. But another thing for you as a dental student applying to endo now, as we're talking about that, since you're in that phase, people have done the dental school application, now you want to do the postdoc program, is you really need to see which program is the proper match for you. And you don't always know that. Every program is good and people make decisions based on various factors. For some people, it could be ease of being close to a location that you may want to live in. It could be financial reasons. It could be a number of different things. One of the factors that is oftentimes not paid enough attention to, which I think is critical, which I can kind of go back into my own personal experience, is the kind of leadership you have in that program and what is, again, the culture of the program, right? Like, I can see myself, if I hadn't come to our program and hadn't been under Annie as my program director, the kind of person I was, my wings could have been clipped very quickly by a program director who wanted to have control, right? Somebody who wanted to kind of make sure that everything is done exactly the way they want to have it done. and they were very much averse to creativity, thinking outside the box, or somebody who wanted to do different things. So that's very important, because the reason Annie is my mentor way after my graduation is just because I did appreciate that, that allowing me to reach whatever potential little it has been, due to the fact that she had that foresight, and that is important. So to the extent where you want to make a decision as to which program you want to go to, you need to also keep a kind of a count of what is it that you want to do afterwards. If you just want to do, as Annie said, just want to be doing like one-stepping, just, root canals, then you probably want to go to a place that's just going to be just purely clinical, and you're just going to learn how to do root canals the least expensive way and move on. But if you want to do other things, you want to have a broader experience, then it's important to kind of know that about the program you want to go to, because there is a variety. And as I mentioned, all of the programs out there that I have been to, and I've been to many of them, UCSF and to University of Minnesota, so many of them. I don't want to name individual ones. There's not been a single one that I have not been impressed by, right, Annie? You'll probably say that. So it's important to do your research on the program from all of these different aspects as well. Did you want to say something, Annie?
No, I'm just saying, I mean, all the programs are good. Are they different? Very much they're different. And again, when I was talking about boards, I mean, I realized there's a lot of programs that are not board oriented, but for me, I was, and I realized people throw darts, but that didn't matter to me, because I was looking to create a program that I would produce people who would change the specialty. And that's what I was looking for.
And also just the questions we're asking here are, how do we better prepare people to get into dental school, to get into endo residency, and then thrive in the specialty? To stay on that theme, I think one of the things from my perspective that's really important is, first of all, coachability. Because, there are definitely programs out there that tend to look for people with, 7 years of practicing experience. At that point, I don't know how coachable you are, but certain programs lean into the fact we know, you're not ready to do an APICO tomorrow, but we'll get you there, and we'll give you the whole 9 yards about how to, prepare yourself for that. That's one thing. The second thing is, I think the fit of during the interview process, you get to understand your fit with the people there, right? So if the like you said, Dr. Nasseh, if the attendings there and the faculty there just don't mesh with you, it's not going to be a good experience for anybody. And that's likely where the decisions come from. If somebody is a fit for the program, they're likely going to be the ones accepted. The part for me that is applicable to dental school and to endo residency is, I think you have to show that you're, to me, somebody who has more interest than just, like I said before, being a cog in the system. Yeah. If I'm selecting people, I want to bring an asset to this program that's going to stay. So to advise people who are looking, let's say, to get into endo residency, I think being unique is important. Like, people say that all the time, and certain schools have that reputation, but what makes you different than just everybody else? I mean, everybody else has a 4.0 or something like that. Why are you different? And so I believe that when you think about shaping your application, you think about where you're going to go, you have to look at what your career vision looks like. So, when I applied, I looked at what does my day-to-day look like? And that was a question. What is your dream? How does your week look 10 years from now? And I answered the question. I had a clear idea, but it meshed with the people I was talking to. So they were mentors, and they were guiding me towards that. So as people are applying towards dental school, first of all, do you see yourself practicing 5 days a week? Do you see yourself dealing with a lot of headaches from owning a practice, or dealing with problematic patients or tough cases, first of all? And do you see yourself from an endo perspective? Do you have the patience to do endo? Mm-hmm. I don't know. I don't know if I do. I mean, I hopefully I do, but it's just so, sometimes it makes you wonder, what OS is like, because things are so in and out. I don't know. So I think patience is my final piece of advice. Is I think if you want to go into endodontics, you either have to be willing to develop patience, or you better be, a hell of a patient person, I think.
For sure. It's funny. Patients oftentimes say, "Well, wow, I can't believe you just sat there for all this time, and you concentrate on this one point for so long," because it seems to be kind of foreign. And that would be a good actually transition. Maybe we move into this question that I've always had, since you guys, this generation, coming into dental school, preparing to get into dental school, and now for studying in dental school. It seems to me, and Annie, you probably agree with me on this, is that as our overall culture is changing to this culture of kind of an online fast attention span, kind of short attention span, just an attention economy, if you will, right? Do you find that it's more difficult for your generation to sit down and study in a long time periods? Because I remember I used to study it would be like many hours in a row. But it seems that even now I can't just sit there and read something for too long. So how has that translated into the tangible experience of studying for dental school and then in dental school? Among yourselves? I mean, you guys are obviously very bright, so you probably have figured out a way to do it, but what has been your observation of your peers and other people on this regard?
Yeah, I think that our generation does talk a lot about shorter attention spans.
Definitely.
Like you can't lock in for 2 hours. But I feel like people have found ways to make it work for themselves. Like I think, more people are getting diagnosed with ADHD. It's more of a topic of conversation. But then you also hear people who may not actually have ADHD say that they have ADHD because they have a trait that is on the spectrum of it. And I think that you see more people jumping from task to task, which is very beneficial because they'll be studying and then there's oh no, I have to send this email. And they get that done. They don't put it off. Mm-hmm. They might be jumping from task to task more. So there could be less deep work. But then for our peers, I think that when the pressure is on and when it really counts, they will focus. The way that I've gone about that, so when I was studying for the DAT, so I graduated college in 3 years. In my sophomore year, spring semester was my DAT. The semester where I studied for the DAT. And I had a full course load. And then the women's varsity tennis coach had asked me to walk on. So she asked me that winter break. And so then I was like, okay, well, I told her straight up, my career is my number one priority. And so I would love to play for you, but I can't commit, however, 20, 30 hours a week. But I would love to play, but I don't want to make any false promises. And she was like, that's fine. So just come whenever you can. So I was like, okay, if I'm going to juggle everything, then something has to go. I want to, give my 100% in all of these things, and I want to maximize my time, be very efficient. And so I deleted all of my social media, got off TikTok end of freshman year, Snapchat beginning of sophomore year, and then got off Instagram sophomore spring. And I've been off of all of those ever since.
Freed up 8 hours a week. Just like that.
Screen time.
I never knew I had so much focus.
Wow.
Right. So I've been on a dopamine detox for over 3.5 years.
You don't
now.
have it anymore?
No.
You're kidding.
I still don't have it.
You deleted it 3 years ago and you still don't have it.
I still don't have it.
Wow. That's nice.
Yeah, that is actually really good.
Yeah. So then that's been my way, and I think that it's made me very intentional in all other aspects of my life, right? Because my thinking then was, the pro is that I have more focus, have less distraction, have more time, and the con is that if someone graduates, gets some exciting thing that they're posting on social media, I'll miss it. And then I won't know. How would I know if it's someone that I don't keep in touch with? But then I was like, if it's someone that cares about me or that I care about, I'll hear it from them. And if I don't hear it from them, then it's just not like that. So it's fine,
That's fair.
It could if I'm thinking about them, I'll text them and then it'll make that happen. Or it just was never meant to be like that, and that's fine. You can't be best friends with everyone. That's fine. Yeah. And so then I think applying that more broadly has made me more intentional and has helped me a lot with balancing everything that we do now.
Yeah, I think that's really fair. I think I have maybe a little bit of a different way of going about it. And this is kind of ties into what I think about even AI entering our space and the way it's entered even our learning space so far. I think that, like you said, people are no longer sitting down and reading textbooks for hours on end. One, because studies have shown that's not the most effective way to study. Active recall is proven to be a better way for most people, I would say. So slowly people are starting to learn how to use this technology. And I think it's very similar to dentistry, is if you don't learn how to use it, it's going to take over and it's going to make things much harder for you. And so if you're able to use those online resources to help your studying, make it more efficient, you have more time to do those other things you might not have always had time to do. And so I think you have to be more intentional about the way that you're using technology, social media, AI, because if you do it and you do it in a way that's pushing you forward, you can accomplish so much more than we once could have. 5, 10 years ago, before I had that ability. Now I'm talking to ChatGPT on my walk to school. Hey, let's talk about this patient, walk me through it. And I'm going back and forth verbally. I'm going on Notebook LM. I'm importing my textbook chapter. I'm having it generate a 30-minute back and forth podcast because I love to listen. I love to watch. I'm ingesting that as I'm doing my laundry, as I'm doing my dishes. I'm finding ways to do my studies as I'm doing other things in my day-to-day. It's also opening up more free time to see my friends go to the gym and do other things that matter to me. And so I think that not that it's about being smart, like you were saying, Dr. Koch, but it's about finding people who I think also make the most of what's going on and are forward thinking in what's around them and how to propel themselves forward using that and not being stuck in time.
Oh, we got to get Roene to do a show on productivity, coaching and stuff.
Master class on efficiency. That was amazing. Yeah, that's a great point. I mean, Dr. Koch, it would be interesting to hear your perspective, I mean, from a generational angle. But do you think, the question I have for you is, you know, sometimes when you show some of these, let's just take AI as an example, because it's I think the pathway to being super efficient. When you learn about some of these things that are accessible to us, like some of these AI tools and platforms, do you feel like it would have, do you feel that you would be in a different place in your career than you are now if you had those tools, or do you think the output would have been the same? I always wondered that, because you're very productive, you're very efficient. Now imagine having the power of AI behind you. What do you think happens there?
There's a positive aspect to it, and there's a negative aspect. I think relying on AI, and there's so many people, this is, it's like in Chatham and Cape Cod in the summer now. Where I am is a very famous hotel called the Chatham Bars Inn. I live on Chatham Bars Avenue. Used to be kind of blue-haired grandmothers. Now it's influencers. And everyone's so busy doing this, they don't even watch the traffic. It's a little bit challenging for older people living in the area. But the one thing here that's interesting, I said it the other night, every generation is bigger, brighter, smarter, and faster. You see that, and you have seen that for decades in athletics. And ladies, I mentioned when I was in high school, there was a British runner, Roger Bannister. He broke the 4-minute mile. It was like, oh my God, this must be an alien. Who can run that fast? Yeah. Now high school kids are blowing that away. It's the same in all your different sports. So you have to break it down. I think one of the things is what makes this generation the greatest generation that's come along is the access to information. I completely 1000% get that. But the one thing that people cannot do is you cannot depend on that for everything. For instance, in the world of continuing education, ladies, Dr. Nasseh and I very much strongly believe in hands-on courses. Because if you're doing endodontics, I want you to think about this. This is the only specialty where you literally cannot see what you're doing. Yeah. Right? Even with a microscope, you can straighten out, you can see the apex. But if it's an acute angle, good luck, you're not going to be able to see it. So having that ability to do it hands-on in person is a big deal. Furthermore, I don't care what you think about the sim labs, taking a 15 blade and going through soft tissue down to the periosteum, down to the bone, there's a feel to that. And you can ask Dr. Nasseh, he's beyond being a superb, surgeon. So I think there is a place for having that manual dexterity, that manual experience.
The chalk carving, Annie, is that what we're talking about?
Paid off.
And then also, where getting back to your question, Parsa, one of the things for many, many years in dentistry, there was very few options. I used to have kind of a joke, a saying, dentistry was like a prison sentence, 25 years to life, right? And people would work 25 years to life. Other than schools, there were very few non-clinical jobs out there. That's changed, I think, significantly over the last 15 years. Also, for me, it got to the point, ladies, I had done Pros for 14 years, and then I had done Endo, and it was like, as I said earlier, I think Endo is a wonderful specialty because it allows you to do other things with your life, yes. All right, whatever that other part of your life may be. So for me, not relying on a computer or not relying on my phone for so much stuff, it gave me, I think, the ability to think, and this is a terrible expression, but out of the box. It gave me the ability to create, okay? And so I found myself at a point where, well, all right, I've kind of got a lot of experience here. Clinically, I've got a lot of experience business-wise. What do I do now? Well, if you really went through a flow chart, the answer was obvious. You had to create your own company because nobody had what I wanted to do. So I had to create my own company, and I created it on Alaska Cruises out of Vancouver, Canada. That's how I started Real World Endo. So the point of the matter is, Parsa, getting back to your point, if I was able, and I was a little bit more reliant on getting information, telling me what to do, we'll go back at another specialty, make your practice 3.5 days a week, hire 2 more assistants. I personally don't think with myself, I would have been able to think outside of that milieu and think circumferentially and create what I created.
Right.
Well, all right. So as we're kind of coming to close on the podcast here, coming to the end, let's just kind of sum up through a series of quick lightning round questions, if you will, right? Mm-hmm. So why don't you go ahead and guide us on this front?
So we'll start with this big question. How do people get into dental school?
Yeah, I think one is you need to know your why. Think big picture in terms of like what are your big goals and what impact do you want to have for your whole life. And then let that be your intention for all the things that you do. That's personal to everyone. And so that will make you unique. Like no two people will have the same vision or the same passions. And then for applying that, there are certain things that will, they show skills that will scale to a career in dentistry. So for high school, college students looking to get into dentistry, research is a very big thing. It shows consistency, it shows intellectual curiosity, the ability to produce, make your own contribution to the field. Yeah. Leadership is also great because it shows initiative, the ability to communicate, the ability to gather a team together, and mobilize a group of people towards one goal. And so it's like, I think there are certain things that you can do, sports is another thing. Yeah. These activities speak about you in ways, so it's like actions speak louder than words, and you don't have to tell someone who you are. What you do will just show those things. So these are very applicable ways to apply that.
I think that's huge. It's demonstrating the skills and the type of person that we talked about who succeeds later as a dentist. And to answer the big scary question of, you post a video, how to get into, I got into Harvard Dental School. The first comment is always stats, question mark. And to my answer to that is, look at the range on the internet. If you fall within the range, you have a good shot. Even if you don't, you still might have a shot. And I don't want anyone to think that the numbers are what's going to define them in this process, but I still want everyone to aim as high as they possibly can to demonstrate some of those qualities like we were all talking about. And that is, that degree of intellectual competence. That is a small part, but a decent part of becoming a strong dentist. And so that comes off in your GPA, which can compensate for a low DAT score, or your DAT score, which can compensate for a low GPA. And regardless of that, not to let those define you, because I think what you said still is just as important as those.
Yeah, those are all important points for to be happy in what you do. But you're right also in the sense that, look, there has to be an equalizer because there's multiple people applying. There's always a competition. So you're getting a bunch of applications that has to be kind of weeded out. So the academic component part of it is definitely an important part of it. But it's a multifactorial issue as to who makes a good dentist. It's not just, you can't just be book smart. At the end of the day, everything you learn has to get applied through your hands and your care and your compassion onto a human being. Exactly. So there is a translation of all that academic stuff that goes beyond what you study. And that's part of your personality and also a part of your overall culture. And that's the kinds of stuff that, you look for in a residence when you're trying to, or a dental student, when you're going through your interview and things like that. So all of these factors are important. It's a multifactorial problem, and there's no one item that is most important. At the end of the day, whether you're a dental student, you have to be able for 4 years to withstand the rigorous process of being through the school. But at the same time, you have to have the cooperative attitude, not just purely competitive attitude, to get along with your classmates, add value so that your faculty, people around you, the staff around you, your patients, everybody can benefit from it. So it's just no one answer, as you guys have all mentioned too.
Yeah.
You need to have the right package to be in the healthcare business to begin with, right? It's a care component part of it. What do you want to add to that?
I think to answer the question of how to get into endo residency, I think I have three things to say: network, network, network. And the reason I say that is because it's your path to exploring what's out there. If you're a dental student and you don't know if you want to be an oral surgeon, endodontist, a periodontist, orthodontist, a GP, you have to talk to different people to understand what your future looks like. So when you do that, you find out what you like. And let's say it's endo, you get to understand what you need to do to succeed. If I'm talking to endodontists and I'm learning about the business of endodontics from an academic research and innovation perspective, I have a vision of what I need to do to be successful and an asset. So that's number one. And one of the aims on our podcast is to be as honest as possible.
Yeah.
Roene said it, Heidi, you said it. You have to have, you know, a certain level of academic caliber. And, you know, the reason for that is because these things are competitive. There's upside to doing certain specialties in certain instances. And so that's how sometimes the wheat is separated from the chaff. You need to be able to continue that from the day one of dental school all the way to the last day. And in the cases that you're pass fail, you need to show how you're different. And so whether you're graded or not graded, your mission is to show that you're going to be an active leader in this community. And I think the only way to do that is to get connected with people, learn from all the people who have a lot more wisdom and experience from you. And that will lead to a lot of great opportunities. And last but not least, I think we talked about how important interview day is. If you get the chance to knock your applications out of the park, spend time and effort to know the programs. If you get to interview day, you have to come 110% prepared, knowing the program and knowing the faculty. That's my advice for how to get into endo residency.
Absolutely.
Love that.
Patty?
I agree with that, Parsa, 1,000%, as I mentioned earlier. So your network is absolutely sagacious advice. It's really smart. And that's one of the things I looked for with my applicants. I wanted to see if they made the effort, if they had the energy, if they had the desire to learn about the program before I interviewed them. So when I would interview an applicant, as I mentioned earlier, I would try to find out kind of the honesty quotient. There's ways I can ask questions. And, you know, the worst thing they can do is try to think, what's the answer I'm looking for? I wasn't looking so much specifically for an answer. I was looking for the delivery. And I would be able to figure out what that was going to be. Also, here's another thing that's gone on this way I've been in dentistry for more than 50 years. It was the same thing 50 years ago. Too many people show up for interviews and they try to be very cool or a little bit chill, that kind of thing. Enthusiasm goes a long way. I've also had people, and what you have to remember, as I said earlier, whether you're the first person invited for the interview or the last person invited for the interview, you have to realize many people interviewing you don't know that much about you. It is your job to sell yourself to that interviewer why they should accept you. I had people who came from very incredibly wealthy families from certain parts of the world. And they would, 3 minutes in, they would talk about their father was worth billions of dollars. Fabulous. I'm so pleased. But what are you going to bring to the program? I don't really care about your father or your mother. What are you going to bring to the program? So again, I think, Parsley, you're right on the mark with network. Know about the postdoctoral program. That impresses me that you've had the energy, you made the effort to know about my program. So that right away gives me great feelings about you and that you would be an asset.
Mm-hmm.
Terrific. And combining that with honesty means that you found the right match for your, for your future, and the right program. Goes back to what you were saying is, finding your why and making sure that you're matched to the right program, not just going through the motions and say the right things so that you could end up in a program that may not be the right match for you. It's not going to help you advance along your long-term goals.
One of the things that I used to do, which I don't think anybody else did, which is kind of unique, I used to also, this is even the same Al with real world endo with different speakers. I would use the Japanese principle of wa. And what wa means in Japanese is harmony. So, when you have all your prospective applicants who you're going to invite for an interview, which one you want to have the most, who's number one. Once I got that person to commit, I'm thinking, who's going to be number two? Who's going to be able to work with number one? Once I had the number two committed, then I had two. Who's going to be number three? Which one of these people is going to work the best? And that worked out very, very well for me. In fact, one time I had the medical school people ask me, what did I do picking this one class? Because all three of them are attached. Two of them are still attached. So for me, that harmony thing, you can translate into a team effort. It's everybody working for the same goals. And I think that makes it for a program director a little bit easier, but far more satisfying when everybody buys into the program.
Yeah, that's beautiful.
Yeah.
Cooperative attitude, that's what it's all about. Well, terrific. I think this was great. And I'm sure many college students that are interested in dentistry and dental students that might be interested in endo or any other specialty could benefit from some of these great tips and tricks that you guys shared, which is genuine and still based on honesty, but can hopefully help people achieve their goals. And dentistry is a wonderful profession. So for those interested in potentially dentistry, Annie, I think that it's a tremendous future. If you think about it, if AI is going to change things, any of the fields of medicine, including surgeries and dentistry, that require your hands are probably going to be affected last, right?
Amen.
So if you're only thinking, you are very likely going to have a challenge. But if you're working with your hands, and this is probably one of those fields in which you're going to be using your hands, you're going to have a great advantage until robotics comes along. And at that point, I think all of us have to.
We're all out of luck. Huh? Yeah.
Everyone is. Annie, what were we going to say?
Here's something for the women, because I think, I mentioned this earlier, between medicine and dentistry, I think the three best specialties on the medical side, it's derm and radiology. And on the dental side, it's endodontics. Why? Because most women, unlike men, have a life, right? Family commitments, other commitments. And so you don't have to work 5 days chained to a chair to be very sated with your education, very pleased with what you're doing with life, and also financially doing well. So I think endodontics as a specialty is terrific, but I think it's especially well suited to women.
Terrific. With that,
Love that.
great wisdom here. We're going to end the podcast. Thank you, Heidi and
Thank you
Roene,
for
for
having
joining us today. And hopefully we'll have you guys back again for doing some
Oh yeah, go
other
quicker.
activities. Terrific. Awesome.
We'd love to. Thank
Absolutely.
you guys.
Yeah.
We'll see you guys in the next video.
Right.
All right.
Yay.
Awesome. That was great.
A show like no other you've ever health and hearts we craft and mold. Tune in to Pulp, where stories unfold.